Last week, Crosse County announced a case where someone was reinfected with COVID-19.
Is that actually possible? Here to talk about that is Dr. Jeff Pothof, Chief Quality Officer for UW Health. Good to see you again, Jeff.
Hi, Dr. Pothof. Good to see you.
Good to be here. How are you guys doing?
Great. So can a person be reinfected?
Well, we don't actually know yet. So the Crosse case is interesting, and there's a few other cases like this around the world. It's possible that someone could get reinfected. The scenario would be that someone would, need to get the virus, and then either something about their body or their immune system, or maybe something about the virus would result in an immune response that wasn't adequate to give immunity for future infections. So that's one scenario. The other scenario would be someone who relapsed into another bout of COVID-19.
So if you get tested and your test is negative and you're not showing any symptoms, should you get retested, or should you only test yourself again if you're symptomatic?
I would say the recommendation would be to test again if you were symptomatic. So with this case, either the individual came in contact with COVID again and actually got it again. That would be concerning because it would create challenges for us as far as our thoughts that maybe you're immune after you get the virus the first time, may create challenges with the vaccine. But we know some viruses can actually live in our tissues dormant, and then if our bodies are stressed out or our immune system is struggling, they can manifest again. Chickenpox and shingles is a good example of that. COVID may be able to do that too. So instead of a reinfection, it may be a relapse where the symptoms of the virus come out again at a later date.
There's still a lot of questions about this, and we learn something new every day, it seems.
I think that's the moral of the story here is there is so much that we don't know about COVID-19 that we still need to learn. So important to not get our hopes up too high that an infection with COVID-19 makes us immune to further infections. I think we all hope that that's the case, but there are enough of these cases that kind of question that thinking that researchers need to do a little bit deeper digging to figure out what really happens once you've been infected with COVID-19 once in the past.
We've had a couple incidents recently where people have had large family gatherings, birthdays or reunions, and then several members of the family have tested positive. What's your recommendation for how people should handle that?
Yeah, I think the large groups, and large not even being what we maybe consider large, 10, 15 people, and then seeing a lot of cases really kind of emphasizes the idea that, social distancing and masking are so important. And I know as the months go on, it is harder and harder for us to stay away from people. And it seems safe to have a small graduation party, maybe a birthday party. But when we talk to contact tracers, these are exactly the events that are spreading the disease around. So for the time being, we just have to be a little bit more diligent. And if we do that, we will more quickly get to the day where these types of parties are okay to do once the virus is significantly decreased in our communities.
Do you think this will eventually be sort of like a flu? You got to get a shot every year?
I think hard to know right now. If the virus doesn't mutate very much and we have an effective vaccine sometime early next year, it's possible that it could be a one and done, kind of like measles or mumps or rubella. But if we start to see the virus mutate and that the vaccine needs to be changed every year, then we would be in a situation where this would be more like the flu, where you're confirmed some protection from previous years' vaccines and infections, but we need kind of a booster or a little bit different vaccine every year to account for the mutations that the virus is doing. Like we talked about before, just something we don't know about COVID-19 yet.
Mm-hmm. And school's right around the corner. The president says that children don't carry this disease. That doesn't seem possible.
Yeah, so children certainly can carry the disease. We know from some studies that younger children don't seem to spread it as much as older children, but that cutoff is about at age 10. So I think it's really important when we're looking at, are we going to send our kids back to in-person education where that's available? Are we going to do virtual? To really assess what the schools are doing. What are those plans to maintain physical distancing? What are their plans around masks, drop off, pick up, hallway time, recess, lunch? Understand those things, and then also make sure that they've got, good sanitation practices in place where those surfaces that, different kids might be using are cleaned on a regular basis, because we still need to decrease the transmission among kids. We know if the kids get it, they might do okay with it, but they're probably going to spread it to adults and others, potentially people at home, that might not fare so well.
All right, the message stays the same. Wear a mask, social distance, wash your hands.
And hope for the best. Dr.
You bet.
Pothof, great to see you. Thank you so much for your time.
We'll see you soon.
Great. You guys have a good afternoon.
You too.